Hi, my name is Ruben, and I'm going to be going over person-centered theory today. So what is person-centered theory? At its core, person-centered theory incorporates empathy, unconditional positive regard, and congruence from the therapist. At its core, person-centered theory is a theory and idea that revolves around the client and is not revolved around any exact guidelines or procedures, rather these three main concepts. So its inventor is Carl Rogers, who said all people have the right to grow beyond the limitations of their experience and work towards greater self-actualization. So why is it effective? We're going to go over that in the literature review coming up, but it's effective because it's able to help clients increase their understanding, positive feelings, self-exploration, and self-concept, which are not always going to be measurable. Although this therapy is very effective at helping clients improve in those areas. The literature that I went over, the first is O'Leary. He says that the characteristics of a person-centered approach are effective in a family setting because it uses the therapist as an interpreter. So they're able to really understand, get those feelings and sentiments out of the different family members and bring them together. And so the therapist is supposed to truly understand each person and then be able to interpret, mediate, and bring them together. Duffy explains that the approach is very effective in individuals experiencing early signs of depression. 74% responded in the first 4 sessions to this treatment. And so it's a good way if people are at the beginning stages of depression to do an early intervention. And he showed that in his numbers. Knudsen and Koch explain how this is a great intervention for transgender individuals because they may be hiding something. They may have been conditioned to have to hide. And so this therapy is able to let those people explore, bring their feelings out, and get to those feelings that they might have been forced to press down over the years. And so the process is inherently non-specific because that's what person-centered theory is about. And so during the therapy, the client should be getting closer to congruence, begin to trust the therapist, bring out their feelings. And the endpoint of the process is not an exact endpoint. It's whenever the client and the therapist come to an agreement. And so for somebody like Janet, my client, she came to the therapist on her own. She was self-referred. She, during therapy, would need to start talking about the relationship has with her sister, start talking about her career goals, slowly begin to trust the therapist, and then possibly come in with her sister. Therapist could talk to the sister, then talk to Janet, and have a group session. Whenever they feel that they've gotten to a point where they're ready to be done with therapy, they can be done with it. And so that's my assessment of it with my client. And in conclusion, person-centered therapy is an excellent approach for families, individuals, and anybody who's looking to explore themselves in a non-judgmental and empathetic setting. Thank you.